Okay, it's 5 o'clock. I'd like to call the Health Committee meeting to order.
Yeah.
This is a special meeting of the Health Committee just to discuss an update on the coronavirus in Albany County. There is none, but we're just going to discuss the county's preparedness plans. I'd like to go around the room real quick to introduce members of the Health Committee and then members of the legislature that are in attendance. So I'll start with you.
Dustin Reedy, represent District 30 in Gilderland.
Hey.
Sean Ward, District 16.
Norma Chapman, District 4.
Pete Tunney, District 22, Colony.
Patty Lockwood, 26,
Dave Mayo, 20.
Dennis Feeney, 28.
Mark Grimm, 29, which is Gilderland.
Merton Simpson, District 2.
Lynn Lukakis, 8.
Bill Rickard, 17th Legislative District, City of Cohoes.
Jennifer Whalen, Colony, District 21.
Paul Bergdorf, 23, mostly Latham and Loudonville. Thank you.
Frank Moriello, 27, Colony.
I think that's it on the Health Commissioner, Chairman Ray Joyce. We're very fortunate. I've received a lot of phone calls in the past week, a few emails about what the county's doing, and I just acted as an intermediary between the legislators and Dr. Whalen. We have our Health Commissioner with us tonight, Dr. Whalen. We're very fortunate to have her, and we've been tracing this from the early stages of it. So we're just going to jump in. She's going to do a quick presentation, then we'll do a Q&A. We only have about 30 minutes, so we'll probably cut it short around 5:30. So, Dr. Whalen.
Good evening, everybody, and I'd like to introduce Shanna Witherspoon, who's the Health Department Assistant Commissioner for Finance. What I'd like to do today is just provide a little bit of update on the novel coronavirus situation currently in Albany County, what we're doing. We have been working very closely with state and federal partners, as well as with local partners from arenas like the hospitals, schools, law enforcement, first responders, meeting on meetings are daily, but with different partners, different frequency to get our arms around planning for this. For those of you that know what we do at the Public Health Department, planning for pandemic has been a huge part of our efforts for probably the last 15, 20 years. So this is an eventuality that we have drilled for, that we have prepared for, we have worked with partners on, and now we find ourselves in a situation where we're using a lot of the skills that we have developed. So I'm going to talk a little bit about COVID-19, which is the name given to the novel coronavirus. Most of you know that these infections started to occur in December and early January in China, in particular in the Wuhan province, and we started to get concerns around them in the beginning of February. It is a respiratory infection. It is spread by droplet, which means if you cough, you can either inhale someone's cough and get it, or a droplet can land on a surface, and if you touch a surface in a short period of time and then touch your face with your hands, you can introduce that virus into yourself. So a lot about the preventive measures that we're trying to spread in the public is on what's called respiratory hygiene, protecting yourself by keeping your hands clean, trying not to touch your face, coughing into your elbow as opposed to your hands, and staying home when you're sick. These are the key messages that we get out every year with influenza, and I'd be remiss, even though you've probably all heard this 100 times, if I didn't state it again. We know that this is a contagious virus, and there are some numbers to suggest it might be slightly more contagious than influenza. And based on the data that is emerging from China, and I have to say all the data that we have on this disease is new because it's a novel strain. So questions on how is this going to behave, what will happen, are really questions that we're basing 3 months of data, 2 to 3 months of data on. So that has to be given in that caveat. We know that 80% of people that contract COVID-19 will have an illness that's like the flu. That is symptoms like fever, cough, other respiratory symptoms, sometimes a little shortness of breath. Most people will be able to manage this at home like you manage a flu if you get it, with taking antipyretics, things that bring your fever down like Tylenol and Motrin, and loads of rest and hydration. In a smaller percentage of people, they need hospitalization, and what's emerging is that we're finding this is older adults who have coexisting medical illnesses, such as COPD or heart disease or diabetes. In this at-risk population, the disease can get a little bit worse, sometimes requiring supplemental oxygen, up to requiring mechanical ventilation. The data on the mortality for this disease, again, is still emerging, so I cannot give you a concrete number. The reports that we're getting are between 1% and 3%, but that's early data. At this point, in the United States, as of the CDC update today, which is for data from yesterday, there are 423 cases in the United States. There have been 19 deaths, and there are 35 states reporting cases. New York State today became the state with the highest numbers of COVID-19. We have 142 cases, 142 cases reported today, and the numbers are expected to increase. We do not currently have any cases in Albany County. The preponderance of cases are seen in Westchester County, which currently has 98 cases. Nassau County has 17, Rockland County 4, Saratoga County, which is of course very close to us, is 2, Suffolk 1, Ulster 1, and New York City 19 cases. So from an epidemiologic perspective, we have seen that there is evidence of community spread. It's not just travelers that are coming back. So this is representing a concern for us. In Albany County, we have tested 11 individuals. We have 7 negative results, and we have 4 pending results. I wanted to talk a little bit about how we are looking at strategies to prevent this from occurring in Albany and from containing it in Albany. There are 2 basic stages around preparedness for a large-scale communicable disease outbreak. And the first of these is containment, and the second is called community mitigation. So containment really looks at how we prevent others from getting the disease when we know there are those either at risk or those that have the disease in our community. So you've heard the words isolation and quarantine spoken very frequently. Quarantine refers to keeping individuals who are at risk of being exposed to a disease in a confined environment until such time as they're out of the incubation period for the virus. So quarantine really, from a strict public health sense, is just for well people. They're asymptomatic, they don't have a fever, they're not posing risks to individuals, but we know that they had a high-risk exposure and we want to keep them contained until they get past that 2-week period when they're at risk of developing symptoms. So we've been involved since the beginning of February with containing, through quarantine, individuals that have come back through high-risk countries. Originally, through China, we would get reports from the CDC and the State Health Department on flight manifests as they came in, and we would contact individuals and follow them on a daily basis for 2 weeks, giving them advice on how to contain themselves at home, giving them whatever support they needed, and making sure that they were not symptomatic. So did they have fever? Did they have cough? In instances where people develop symptoms, we coordinated testing. All coordination of coronavirus testing was through the local health department until the guidance changed this past Friday at 4 p.m. So we did all the coordination of testing with originally the state and CDC, and as many of you know, this testing became available through the Wadsworth lab last week. So we have been very hands-on with this outbreak. Current travel restrictions and recommendations include avoiding all non-essential travel to China, South Korea, Italy, and Iran, which are the level 3 countries. And we really are starting to monitor people that are coming back from the level 2 countries, which are a broader list of countries that are coming back. The CDC's recommendation recommending travelers, particularly those with underlying health issues, to defer all cruise ship travel at this time. This was a new recommendation this weekend. And they are all also recommending those at high risk avoid crowds, long plane flights at this time. And those at risk include older adults, individuals over 65, and people with chronic medical conditions such as heart disease, diabetes, and lung disease. So what these containment measures are designed to do, if you take a communicable disease outbreak and look at it over time and the amount of people that are affected, there's a curve that looks like this. You get a large amount of people infected in a very short period of time, and it overwhelms a lot of our infrastructure for health. What we're trying to do with these mitigation strategies is to blunt that response and make it last longer and make the height of the curve less. So the strategies around containment really aim to decrease the total amount of people that are infected, and also giving us time so that we can have the appropriate response that we need across the health sector. The next stage, if you look at containment, the next stage is that community mitigation strategy. So once we start to see transmission occurring within communities, we start to talk about larger measures of how we can control movement in the public to stem the tide of the disease. And these are called non-pharmaceutical interventions. So pharmaceutical, as you know, interventions include drug treatments. These are community-based treatments, and they include things like community measures, altering business practices to have social distancing so people are a distance apart, that they're not at risk, having policies where people can work from home, having plans in place for if your child's school is disrupted or daycare is disrupted, and working with partners in the community around places where we know people are at risk, like schools and universities, etc. There are also personal measures, which again go back to hand hygiene and cough etiquette. And then there's environmental non-pharmaceutical interventions, which are things like cleaning. How do we clean areas to prevent the germs from living on surfaces for a long period of time? In terms of the response of the local health department, as I said, we've been very involved in active monitoring of those who meet the quarantine criteria. Currently, we have 20 individuals under a voluntary quarantine. And voluntary quarantine generally means they came back from a high-risk area, and we're keeping them in a controlled environment. On Friday, the governor came out and added an additional layer to the quarantine protocol called mandatory quarantine. These individuals actually have a legal quarantine order served to them that says you are mandated to stay home. And these would include individuals who may have contact with a known case, or individuals that came back from a high-risk area and are now having symptoms consistent with COVID-19. If they're symptomatic, the likelihood is that we have referred them to testing. Sometimes it takes a day or two to get that testing back, so we keep them in place so they're not circulating around, and again, monitor them on a daily basis. Those individuals that are under mandatory quarantine, all individuals under quarantine get contact from us once a day, but those under mandatory quarantine have a phone or text contact and an in-person contact to make sure that they are in their homes and adhering to the requirement. So we have been at the agency of implementation for the quarantine. We, as I said, coordinated all testing prior to Friday. We've had frequent briefings with the CDC and the New York State Department of Health. We are disseminating information to hospitals, healthcare providers, schools, emergency management, other partners, taking a lot of calls, doing a lot of media response, providing updates to our website, and we've been involved in daily planning meetings. A further thing that would be our responsibility, which we have not had to utilize yet, is if there are cases in Albany County, it would be our department that would be responsible for doing all the epidemiologic investigation. So if we have a case, our epidemiologist reaches out to that individual to find out Who have you been in contact with? Who could you have put at risk while you were symptomatic? And those individuals then are quarantined. So as you see, it kind of expands out the work that we're doing once cases are identified. And at this point, we have not had any cases. We have done what we can to increase public awareness for household preparation. There was a press conference held last week that we widely shared a document the CDC has released, which is how to prepare your household for COVID-19. People are asking, what should I go out and get? What should I have on hand if I'm asked to be quarantined, or if my child's school or daycare is closed? This is helpful. There are a wealth of guidance, information, and documents on the CDC website. And one important point that I would make to members is that there is a lot of fear-mongering going on. There is a lot of misinformation on the internet. Please know where to get trusted, good source of information. Our health department website, the New York State Department of Health website, and the CDC has invaluable guidance. So there is guidance there if you need to take care of someone in your home that has COVID. If you need to live with someone who is quarantining, how do you do that? Of course, we can provide this information too, and will in situations that it's warranted. But to prepare is a good idea. And I, was interviewed the other day and was asked about panic, and I said, panic is not preparing. We really need knowledge to prepare. So I would, encourage all of you to encourage those that you represent to use appropriate sources to brief themselves. With the business preparation, as we know, there are a lot of concerns about what this is going to do within the business sector. We're encouraging employees or employers to take a look at their sick policy. I understand, I think today there was some information at the governor's press conference that there may be legislation around this to protect those that need to stay home, but I don't have any specifics on that yet. It's important within businesses to emphasize the importance of respiratory hygiene, to perform routine environmental cleaning, and there is guidance on that as well at the CDC, in advising employees that are traveling to take steps to prevent them from getting being at risk. It's important to know that if you're abroad and the country that you're staying in is designated a level 2 or level 3, when you get back, you're going to be asked to stay in place for 2 weeks. So that is something that factors into a lot of people's travel plans. It's incumbent on employers to look at whether they can establish flexible work sites, flexible hours. How can they identify essential functions in staff so that they can continue operations as they need to? And it's important to establish communication with all of their employees. There is a lot of additional guidance that we have and that the CDC has, including guidance for childcare, schools, colleges, university, healthcare professionals, first responders, law enforcement, community events, and many, many more that's available on the CDC website. We are happy to be a resource to anybody in Albany County that needs further information, and as I said, we're going to continue to follow this along on a daily basis. It is my expectation that we will get cases. It is my expectation that as the criteria for testing expands, the number of total cases in New York State will go up before it comes down. So I think that it's very important for us to keep a very close eye on this and to continue the strategies that we're currently employing.
Thank you, Dr. Whalen.
Question back there.
Actually, we'll start with Sean, who's on the committee, and then we'll go around the room. We'll take questions from the health committee first, and we'll take it from all the rest of the remaining legislators.
I just had 2 questions that were asking me today. Surface contamination, they said it wouldn't be the 14-day incubation period. Do we know how long
It lives on surfaces?
Yeah.
It's not 14 days. There's a lot of different reports in the media. I think the most reliable information that we're getting is hours. But the question of how long something lives on a surface is important for cleaning, but it's also important for people to realize high-touch surfaces need to be cleaned, and you need to be careful. So a doorknob is a high-touch surface that no matter how often people are cleaning, within 10 minutes, 10 to 20 other people could have touched it. So people need to keep in mind that high-touch surfaces are where you wash your hands or use hand sanitizer after you touch a high-risk or high-touch surface.
Second question I had, I was at a meeting today locally. If there is a case in the municipality, will they be notified, municipal or school, I would assume?
So that's a good question, and I think, in terms of, you're asking if the municipal leader would be identified.
Yeah, I'm actually an emergency manager, so will we be notified of the school, if it is the school?
Certainly the school would be notified. I think that there'll be a lot of notification that goes on almost immediately. We really, are very cognizant of getting this information out as quickly as possible.
I mean, we're very happy to turn the situation over to the health department.
Right, but you want to know. You want to know, and I understand that because we're getting calls every day. We hear there's this case here, we hear there's this case here, and what I've shared with the executive's office is that if there's a case, we'll be on the phone right away. So I'm glad you indicated municipal leaders. We'll make sure that is specifically
Yeah, because they're meeting now Thursday, all the emergency managers will be in the sheriff's department.
Yep.
So,
and we met with emergency managers through our HOC, Health Emergency Operations Committee last week, and we're going to meet with them again next week for updates.
Thank you for your leadership on this plan.
Yes, thank you. So we did get a few emails also specific to the county facilities. As you probably know, there was a nursing home in Seattle that was affected by the coronavirus.
Yep.
Are we working with our Albany County nursing home?
Absolutely. Yes, so we've been working with our partners. The guidance for nursing homes from the CDC came out just this weekend. But in advance of those guidance, we have had contact with them. This goes along again with policies and procedures that have been in place around times where we have flu season. So, we really know if there's a lot of respiratory illness, it is important to screen people as they come in. If you have a cold or if you're experiencing respiratory symptoms, it may not be a good idea to come in and visit your loved one who will be at high risk of developing complications. So that is definitely in place. I know that they have signage in place as of last week.
Mr. McLaughlin, with a question?
Thank you. I heard today that the governor had said that New York State was going to be making their own hand sanitizer, and that...
I saw that.
So I was wondering, do you know if we're going to have access? They said it was going to be distributed to like schools and nonprofits and places like that. So I was wondering, do you have any information on how it's going to be free, but you could also have access, you could also buy it, but where that's going to be, do you have any information regarding how we could get access to that hand sanitizer, because it seems to be in short supply.
Yep.
And being black marketed at this point. And they say that what the state is making is going to be even stronger than Corel. So I'm just wondering, do you have any information on that?
I don't yet. I, like you, watched the press conference today and heard the governor introduce this and that these supplies will be made available. I do also know that he has introduced legislation against price gouging as of last week to try to stem this blatant opportunism of people selling Purell for $300 a container. Obviously, that's something we want to guard against, but I haven't heard yet how that's going to come to us. I'm happy to share that information as soon as I have it.
Thank you.
Mr. Bergdorf?
Commissioner, I read with some surprise this morning that RPI is running their hockey games without spectators.
Mm-hmm.
And they're doing that out of an abundance of caution. We have a large number of public events, whether it's at the TU Arena or whether it's at a St. Patrick's Day parade or a party, etc. Any particular guidance for how those things should be handled, or is it a wait and see
So
attitude?
I'm glad you asked me about that, and actually I have received individual communications on both of those gatherings that you reference. In terms of canceling large-scale gatherings, universities have it, any agency and any place of business can say, as of today, we're going to work from home. As of today, we're not going. So they have the right to do that within their individual institutions. From our perspective, what I've shared with the organizers is that this is very dynamic. We're watching this evolve across the state. Due to the fact that right now we don't have any cases in Albany County, I would not advise against cancellation of mass gatherings, but this is dynamic and could change readily. So if that guidance were to change, I have a contact list that I would be reaching out to, and it's likely that that would be in the press as well.
What is the chance that the CDC will start branding states with those numbers like they're doing in Europe, like the 2 and the 3? I have kids that are at school, and the schools are sending out notices that if they leave the college campus and they go travel in a CDC designated area that's above a 2, they'll have to go into quarantine for 14 days. What is the chance or the likelihood that the CDC will, so my kids are coming to New York, but I'm wondering if I should have them go to Maine where there's no cases, because I want them to be able to go back to school without quarantining or being in a 14-day isolation. So is the CDC, do you see any chance of them declaring New York State, because we're in a state of emergency, as a 2 or a 3, or any likelihood of that happening?
So the first thing is that the declaration of emergency doesn't necessarily equate to a level 3. What the CDC did in their guidance was that they did, when they talked about level 3, classify areas of Italy and and China in particular. So there's a possibility that they may do the same in the United States and say, we're going to say this area of the United States, but I don't know that. Obviously, the CDC is an American institution looking to protect Americans. A lot of what they do is to look at Americans traveling abroad, but as this begins to evolve, it could actually be a structure that they implement.
Do you see it when you study their designations abroad, is it patterned on amount of cases, or like 10 or more?
It's not
percentage of cases?
It's not a specific number. It's just a widespread outbreak in a community.
Mark? Yeah, it's still unclear to me about the hysteria, because the flu is a killer. Every year, all the precautions you're talking about, doctor, you're out there every year.
Yes.
The CDC says between the last 10 years, it's killed the flu between something like 12 and 61,000 people. That's 36,000 people a year, which is 10 times the amount of people killed in 9/11.
Yep.
So, yet they don't close the schools down when one kid gets the flu, which I think we saw downstate. One student got the flu and they closed the whole school down. Why are we acting differently than any other flu? Because they're all killers.
This is not the flu. This is definitely not the flu. The flu is influenza is a different type of virus, and we have an immunization against the flu. And because the flu, although we know there's genetic mutations to the flu every year, and that's why we have to get a different flu shot every year, the vast majority of the population that's older than a year old has some sort of immunity to influenza. Haemophilus influenza. So we know that's in existence. This is a brand new virus. This is something that no one has immunity to. And because no one has immunity, and because we have not got something like a vaccine, we're paying very close attention to how it's affecting people that get the virus. We know that, and again, the data is preliminary. We have a very short span of time compared to how we can talk about influenza, what we know about it from a large body of research over many years. But there are some indicators that the disease can be more serious in a subset of the population. And because of that, it is definitely different than influenza and should be given a different level of attention.
Even though the symptoms are the same, essentially, it's the unknown. the lack of vaccine means the fewer people are protected against it.
The symptoms are the same. There are some differences in clinical presentation. There are some differences in the radiology. If you look at the the CAT scans of individuals that have coronavirus that do develop serious complications, there's some differences. There are definitely some differences. But if you're coming down with this, yes, it can look just like the flu or another respiratory virus.
Do we know of cases of people who've been affected by the virus that within a 3 to 4 week period without treatment have moved to wellness?
Oh, yes, absolutely. Yeah, the treatment for coronavirus is just supportive. There is not specific drugs that help treat this, although there are some antivirals that we're currently studying that may be helpful. But 80% of people that get this will resolve and will go on to be fine afterwards.
Just real quick, what level of saturation has to occur before it reaches the parameters of a pandemic?
That's a good question. So, the World Health Organization is the agency that usually declares a pandemic. And, a pandemic is different than an epidemic. A pandemic refers to widespread geographic, across the world of a virus. And it usually means it's a virus that we haven't been exposed to before. An epidemic just means we're getting more in the community than we usually have. And every year we have flu epidemics. But pandemic is really reserved for a very small subset of diseases. Looking at the map that we're seeing currently, this is what, if you look at the map of the world, and I know this is small, all these dark blue areas have been affected by COVID-19. So we really are starting to see this spread around the world, and I am not sure yet why the World Health Organization has not classified it as a pandemic.
Ms. Willingham?
You said this is a new type of virus.
Mm-hmm.
All right, so I went into Family Dollar and I bought some Lysol.
Mm-hmm.
And it does have the coronavirus on the can.
Mm-hmm.
So how new can it be?
So that's a good question. And, we were when we were sending tests out originally, because we were, in the incidence of this time of year, we were saying, okay, if you're sick before this has really become widespread, the likelihood is we're still in flu season and you likely have influenza. So we were suggesting providers get a respiratory panel. And when they started to get the respiratory panels back, it would say, this says coronavirus negative. Well, there are some circulating coronaviruses that people get that cause symptoms like cold. But this is not the same strain as this new strain.
So the Lysol is not effective?
The Lysol should be effective.
Oh,
yes.
Should be?
Yes, it should be effective. But it's just that there are more coronaviruses circulating than novel coronavirus. So this is similar to, remember years ago when we were concerned about H5N1. That's a flu virus, and but it was novel. There was a novel strain. So that's what makes it different. There are coronaviruses around that circulate that we test for as part of a regular respiratory virus panel, but not this new one.
So I just want to ask one other question. So when you said 80% would recover, does 20%, should I think that 20% is a lot? When you say recover, is 20% people, does that mean 20% of the people are dying?
No.
Or
and thanks for asking so that I can make that clarification. 20% of people will have complications that require them to either be hospitalized or to have, intensive care unit type care. 5%, around 5% really need ICU care. But we think the mortality rate is closer to 1 to 3% of people.
Right now?
Yes. So that means of 97 to 98 people out of 100 that contract coronavirus will recover. Now, what happened in Washington State was extremely unfortunate because it hit a vulnerable group of individuals. And we know that those were a group of individuals that just by their general health were more at risk of developing severe disease.
So what are we doing at Albany County Nursing Home?
Right, so Albany County Nursing Home, we've been in contact with them. They have signs to try to prevent people that have respiratory disease from coming in. If we get to the stage where there is widespread presence in the community, or even if we have a couple of cases, we may consider, as some places have done, stopping visitation during that time. Obviously, that's not something that we want to do unless we have to, because people like to have their visitors, but we really are encouraging those that come in to practice appropriate hand hygiene and not to visit your elderly relative if you're experiencing any symptoms of a respiratory disease.
Muriel?
Just one quick question. I've heard that children are not as susceptible to the virus as adults. Is that true?
So it's interesting. The reported cases that they have out of China is really a small percentage of them are children. So this can mean one of two things. It can mean children aren't susceptible and they don't get it, or it can mean children get such mild disease that they're not tested. And we don't know which that is. The children don't seem to have severe complications. And a very low percentage in the studies that they have of testing that they've done have been children. So we don't think children are at risk or at a particular risk. But it's important to note that, we know that young, healthy people every year, unfortunately, contract and do die from influenza. So we cannot say there's zero risk to kids. We have to still be cautious.
Mr. Burkhardt, did you have a follow-up?
Just a question, where would we find what the level 2 countries are?
On the CDC website.
The map is very clear. I've been out petitioning, like many of you, and sanitizing my pen, every 2 doors. But the constituents, the kind of questions that they're asking me are more anecdotal. And they need some help making decisions, like, should I go get my mother out of her apartment and bring her to my house? Should I let my kid come home from Baltimore or Florida or Iran or wherever the kid is? Am I putting the kid more at risk? So who's the kind of person that could help them with this, like their doctor, their therapist, their
The therapist?
Well, I'm just saying, like, I have to make my own decision when my time comes.
And people have a lot of questions. So there is a hotline that the state has set up to answer questions like that. That would probably be the first line that I would utilize for general questions related to COVID-19. At the local health department, we're available as a as a resource. I'm just thinking, our staff now, as you can imagine, we are having to move staff from one division to another as we start to ramp up. So we're happy to be that resource to the community, but we'd probably send people first to that hotline for New York State Department of Health.
So we have Granicus training starting shortly, so I can probably take 2 more questions, Mr. Ricard.
Just a quick question, just to follow up. You said on Friday you got a new directive from the State Health Department, right? So how does that work? So you're going to have an actual order, a legal order to go into somebody's house per se? You're going to show up with their house with that order?
Yeah, it's not to go into someone's house, it's to ensure that they stay in their house. And yes, they have provided legal language, and we're working with county attorneys. We had worked with county attorneys since the beginning of February on crafting mandatory quarantine language. This is something that occasionally comes into place. A few years ago, there was an outbreak of mumps at SUNY, where we used a mandatory quarantine order. In situations where there is what's called imminent risk to public health, the local health commissioner has the ability to issue those type of orders. Obviously, they don't occur. It doesn't occur very often. But in this situation, what the governor mandated was that counties utilize their own legal resources. They did provide some template language for us. We are refining that. We're passing it through all of our attorneys. And yes, that will be handed to them. And there are associated penalties with not keeping quarantine.
So I just want to clarify though, because I did read the directive, from the governor's office myself. So it mentioned something that the individual has to be quarantined in a specific room, would have to have a door in that room.
Yep.
So are you not I mean you personally, is somebody go in that home and to see if that door is on there to quarantine that individual?
So, We do, even though it's unusual for us to be in this current situation, it is not at all unusual for us to be in situations where we have to either quarantine people or monitor them at home. People in general are pretty trustworthy. People don't want to run out of doors to put other people at risk. They have families that they care about. They know that we know who they are. So the outreach for the people that have the voluntary quarantine is by phone or text, and the outreach for individuals that are under mandatory quarantine is an in-person assessment, and then also a phone or text. So it's twice a day kind of monitoring.
Thank you.
Oh, we have time for one more question if there's anybody else that has any follow-up. So, thank you, Dr. Whalen. It's Witherspoon too for joining us. It's very, as you heard, we got to do our part, get it out to our constituents and neighbors, to do our part, to wash our hands, sanitize, and you're sick, stay home. Most of us won't be affected by this or have very little effect, but we have to protect that portion of the population and be most vulnerable to it. So, thank you for joining us.
Thank you. It's my pleasure.